Hi, in this lecture, we're going to talk about some movements at synovial joints. And you've already learned most of these already as we've been studying the upper extremity muscles, but now we're officially covering them for the lecture portion of the class. So we have flexion and extension. And remember that flexion is bending and extension is straightening. And they both happen in an anterior and posterior plane. So one way to think about flexion is that it reduces the angle between the bones. So remember that muscles typically cross over bones and insert, and when they contract, they pull the insertion towards the origin. So I'm going to try to turn here and you can see my elbow. So if I flex my elbow, right, notice that I'm bending it, but look at the angle. See how the angle between the bones is getting smaller, and now when I straighten it, the angle gets bigger. So flexion and extension. We can do it of the neck. Flexion, extension. Now, let me turn again. If I flex and I extend, I can also sometimes hyperextend, which means beyond 180 degrees. And so we talked about the fact that most of the time, except for the knee, remember that when you flex, you're going to be moving forward, so the muscle's on the front of the body to pull you forward. If the muscle's on the back of the body, it's going to pull you back. So it's going to extend, except for the knee, because when you bend your knee, it bends back, right? So those muscles are on the posterior side of the knee. Now there's something called horizontal or lateral flexion. There's a couple ways that you can see this. One is if you are bringing your ear to your shoulder. So if I do side this way, see how I'm bending it sideways? This is lateral flexion of the neck. I'm not very flexible. You can also do it if you flex your shoulder and you come across the body. This up here, lateral. You can also do your trunk, right? If you look in the picture here, if you're doing like a side bend, you can also do trunk or torso. Now, plantar flexion and dorsiflexion are special just for the ankle. So you can see in the picture when you bring your toes up, let me try to see how the toes are coming up. I'll pretend my hand is a foot. Toes up, that's dorsiflexion. Pointing your toes is plantar flexion. You're pointing, think P for pointing. Okay, so those are some of the special movements in the anterior posterior. Now, remember that abduction and adduction, if you move it away, so I'm doing my shoulder abduction, if it moves away from the midline, it's abduction, and we can also do this in our wrist. So remember our thumb, right? We abduct or adduct, and probably see a little better in this picture. So when we looked at muscles, we said that if we were talking about the wrist, if a muscle was on the thumb side, it would move it laterally away from or abduct. So any muscle that's on the radius has to abduct, and any muscle that's closer, right, that's over here by the ulna is going to adduct the wrist. So those are also for the wrist, and we also look at these for the shoulder, and we look at them for the hip. We're not doing the finger ones. So if you move the limb away from the midline, abduction. When it comes back, that's adduction. And that's commonly seen in the shoulder and the hip, and we look at it in the wrist. Okay, now rotation is actually turning the bone, right? It's actually twisting or turning along its axis. So when we're looking at rotation, we talked about internal rotation or medial. So you could do this with your shoulder, but I'll try to make the ball and socket here, right? With the head of the humerus and the glenoid fossa, it can turn in or it can turn out, right? And you can palpate that. Put your hand on your shoulder and turn it. And you also will see this on your hip. So I don't care if you call it internal rotation or medial rotation, or if you want to call it lateral rotation or external, that's up to you. But those are our rotation. Now, just like for abduction, we said the muscle has to cross over the top of the joint to abduct, and adduct brings it back, so it has to originate on the midline, right? If it's going to pull the insertion to the midline, bring it back to the midline. When we look at rotation, if the muscle inserts on the front, so I'll pick on the humerus right now, if it inserts on the front, it's going to pull it anteriorly, which is medial rotation. If it inserts on the back, it's going to pull it toward the back. So if you're thinking about where the muscles are, a lot of times you can figure out what they do. Now, pronation and supination only involves that proximal radial ulnar joint, right, when we flip. So when pronation, palm down, supination, palm up. And so in anatomical position, remember that we're supinated because our palms are forward. So only muscles that insert on the radius have any shot of doing this because remember the ulna is stationary. So other movements that we'll see at synovial joints are inversion and eversion, and we're only looking at these in two places. We're going to look at the jaw, so you can move your jaw. I'm trying to do it. I can't do it and talk. Move it forward, protract, and backwards. And also we look at, we did that with the scapula. Remember, you can call it the scapula protraction, retraction, or abduction and adduction. That's up to you. It doesn't matter to me. And then we have inversion and eversion. And we look at this with our ankle, right? So when we invert or we evert, so this could be, you can see how the ankle is kind of twisting a little bit. So think of inversion is kind of putting your pinky toe down and your big toe up, right? And then eversion is the opposite, your big toes down and your pinky toes up in the air. That helps you remember those. Now, the other one we talked briefly about, this is only for the scapula, remember. The scapula can go up and down. So think about your scapula moving. And so we have elevation and depression. And sometimes you can get this movement, you can get two movements in the same muscle, right? Because the trapezius has an upper trapezius and the fibers are on this way. So it pulls the scapula up. But remember, it has fibers down here that can also pull it down. And so whenever we look at joints, we look at flexibility and we look at what's called range of motion or range of movement, ROM. And it's very, very important that you maintain flexibility. You want to be able to exercise. You want to use your whole movement, right? You don't want to just use partial movements when you work out. Full range of movement, and it helps with maintaining your fascia, your tendon, your muscles, and your ligaments. So this concludes our lecture on movements at synovial joints.